What's good, YouTube? So today is Friday, July 22nd. I think it's July 22nd. I'm losing track of the dates. Yeah, it is. Headed to surgery right now. I'm actually at the hospital looking for the entrance we have to go in. About to finally get this Achilles surgery so I can begin the road to recovery ASAP. I'm starving right now. It's 10:50 a.m. My surgery's at 1, but I haven't been allowed to eat a meal. I wasn't allowed to eat a meal past midnight last night, so I am starving. Can't drink anything, can't eat anything. You know, all that stuff for anybody who's familiar with surgery. But I'm going to try my best to see if afterwards the doctor can just give like a quick overview of the procedure he's doing on me, just because I can't really explain it in medical terms. So if he can't, I'll do my best to explain it and maybe have my girlfriend explain it as well, because she works in that field, so she has a better understanding of the procedure than me. So yeah, that is what's going on. I will be back to see you all after the surgery. Wish me luck. Alright, so surgery was successful. I didn't have an opportunity to get the doctor to speak on camera just because I was heavily sedated and I honestly didn't even remember after the surgery. But before I went into surgery, I got a general description of what exactly he was going to be doing, and he is the only doctor in the country right now that does this type of surgery on the Achilles, which helps the recovery time tremendously. And I'm actually a part of a study of one of his studies. He said I'll be receiving paperwork via email in about 6 months or so. So I'm the 8th patient who he's done this surgery on. And basically what the doctor did, my girlfriend is in the background, so she's going to correct me if I'm wrong, because she knows exactly, you know, what the procedure was. But he did first I had, what was it called, like a block?
A nerve block.
A nerve block, which basically sedated me. And then I obviously had anesthesia, and that put me to sleep. So I was turned over on my belly, and I had like a tube down my throat in case like they needed to attach it to what for?
Well, it's to help you breathe, and also
to help me breathe, and
then if they, like, just in case they need to attach it to a ventilator.
And just in case they needed to attach it to the ventilator. So if my voice sounds off, I apologize, but my throat is sore as hell right now, like super sore. Hurts to even talk. So basically what he did was he did a horizontal incision. So if you see a lot of people who've had like Achilles surgery, somebody like Kobe Bryant or something, I'm pretty sure his is vertical. I'm almost positive it is, but most people have like the vertical incision. The horizontal incision is something that just started happening recently. So he's not the only doctor who does the horizontal incision, but he's the only one who does like a modified version. So my girlfriend's in the background. I'm not gonna put her on camera because she's in her pajamas. She's been up all day. She was at the hospital with me all day. She had to go to work today. So she's exhausted, but I am gonna have her kind of correct me in the background. So he did the horizontal incision, and then what did he use to?
Some type of like apparatus.
So he used the apparatus
where it attached wires to your calf and tendon.
So he used the apparatus that attached wires to my calf and my tendon muscle, and that then he pulled the apparatus, pulled the tendon, or pulled the wires down to my heel, right?
Yeah.
So he pulled the wires down to my heel, where and when he got to the heel, he actually drilled 2 holes in my heel, like in the bone, and then he attached the wires to that heel.
Yeah, so it pulled the muscle, and then it pulled your Achilles tendon together. And I believe he sewed the Achilles tendon together.
So that pulled the muscle and my Achilles tendon together with him using an apparatus and you know, taking that wire all the way down to my heel. And with the rods in my heel, they're in there now, but they're going to dissolve over time. But he did tell me that I will feel that pain whenever the meds wear off from the surgery. And my foot is still numb right now, so I'm going to try to stay ahead of things with the pain medication. And did I miss anything?
That's basically it. Yeah.
Okay, so that's basically it at a high level. Sorry I couldn't get him to explain it, but that's what I got. And like I said, he's the only doctor in the country who can do this type of surgery. So I'm actually excited to see my progress and, you know, how fast I progress. I'm going to be safe, but I'm going to try to get back as soon as possible, but I'm not going to re-injure it. So right now I'm in like a walking cast. I have it bandaged all the way up, and I have a machine that I have to use. I'll show you all that in the next video. My girlfriend is going to show me how to use it because I have no idea how to use it, but I guess what it does. What's the machine do?
Basically, it helps ice, but it's like constantly flowing cold water in sort of like an inflated pad. So at the same time of it, it's like icing. It's a form of icing.
Okay, so it's like a form of icing. It's some machine. I'll show you all in another video because my throat hurts a lot right now. But yeah, so that's where I'm at right now. So this is July 22nd, right after surgery. I'm going to keep you all up to date, and as soon as like I can get more feeling in like my my foot and just that whole area, I will be, you know, going to the gym to do some seated exercises. So stay tuned for that. And yeah, I'm just going to try to make this an epic comeback. So I'm not even tired right now. It's super late. I went to my girlfriend's parents' house after the surgery, had some food, you know, took some pain medication. So about to get ready to just lay down now and just relax. I'm sure once I lay down I'll fall asleep, but everyone who has reached out to me, all your messages, whether it be on social media, text, phone calls, I appreciate it. And I will be coming back from this better than ever. So please comment, like, share, subscribe to my channel, and I hope that I can motivate someone. All right, see you on the next video. Peace.